our Healthy Living segment. And today we're joined by one of the top surgeons in our area, plastic surgeon Dr. Michael Kim. He was actually on the team that performed one of the first successful hand surgeries in the world. And now he is here talking about an issue that a lot of people have, a big issue that presents as small pains in the hand that can cause big problems, but it sounds like are a pretty easy fix. Dr. Kim, thank you for being here.
Thank you.
So what exactly, this is called a glomus tumor.
Yeah, I think it's glomus maybe.
Glomus, okay.
So there's a glomus body, which is a little tiny connection between artery and veins. Usually happens in the hands and feet. That's where they occur. And they regulate temperature. So when it gets hot, they open up to dissipate heat. When it gets cold, they contract so that it holds in your heat. So it's a thermal regulator. It regulates our temperature.
Okay.
And these little glomus bodies can become tumors. Very rare.
Wow.
I think about 1 to 5% of all hand tumors occur as glomus tumors.
Wow, okay.
But it's interesting because I might see one every 1 or 2 years. And I think the average time I read one article to get a diagnosis is about 5 to 7 years.
Oh my gosh, so they live with the pain
Right,
during that
so they
entire
get bounced
time.
around. Usually when I see these patients, they've been told they're crazy, they go to their doctor and another doctor and they have this pain. And
Sure.
and everyone thinks, because you can't see the tumors often.
Ah, okay.
So luckily, once they finally see a hand surgeon, usually we know what it is, just by history and physical. And interestingly enough, by history, a very painful spot, when they put their hand in cold water, gets severe pain.
Oh, wow.
And usually it's debilitating, very bad.
Really?
One of the tests we can do is called the love test, where we take a little pen and just press on the area that hurts, and they get excruciating pain. The other thing is you can put the finger in cold water or foot wherever the tumor is, and they get severe pain. Once we're pretty sure what it is, a glomus tumor, then we usually order an MRI or an ultrasound to find out where it is and exactly where it is for surgery. Luckily, surgery is very curative, almost 90%.
Wow.
And it's relatively simple surgery. However, sometimes the tumors are in difficult areas to get to, like under the nail.
Oh.
So you have to take the nail off, cut out the tumor, and sometimes they do occur about 10% of the time because of the difficult areas to get to.
We're seeing some of the pictures of some of the areas here. A lot of people are probably going, oh gosh, I'm feeling numbness in my hand, or maybe my foot hurts in this little spot. How do you know if this is something that is concerning enough to come to a hand specialist like yourself, or if this is something that they can just brush off?
Well, I think if it's something that continues to bother you for months and months, a severe pain in the spot in your fingers or feet, then you have to start worrying. If it's just a little spot that hurts for a couple weeks and goes away, no big deal. But these tumors, the pain does not go away. It persists for months or years until finally you get diagnosed. So it's a very, very tender spot, somewhere in your finger or toes. That's the most common areas. Once you have these symptoms for a while, I think it's good to see a hand surgeon just to take a look.
It sounds like it is overlooked a lot by surgeons who might not be aware of what these are.
Yes, glomus tumors.
Glomus tumors. All right, Dr. Kim, thank you so much. How can we get in touch with your team?
Oh, my website, michaelkimmd.com.
All right, thank you so much, Dr. Kim.
Sure.
We'll put that information, how you can get in touch with Dr. Michael Kim, on our website and, of course, on our Gulf Coast News app as well. All right, we're looking for some fun, a new fun family spot that I think your kids are going to love. Jason Drew is golf coasting in Alva this morning.